Hello, Meredith, and welcome to the first practitioner interview of 2022 in our Compassionate Women's Health community.
Thank you for having me, Belinda. Lovely to be here.
I know, it's so good to have you back. So you presented for us early last year on PCOS, and I'll just do a bit more of a formal introduction of Meredith. So Meredith East-Powell is a clinical nutritionist who takes on evidence-informed approach to treatment. Clinical nutritionists approach healthcare in a holistic manner and look at the big picture in regards to health. Meredith works with clients with many different health issues. However, her special interest areas are women's health and digestive health. Meredith loves simple yet delicious food and strongly believes food should be a source of pleasure. So her ethos is about teaching her clients how to eat in a way that they enjoy and that suits their body and their lifestyle. So do you want to tell us a little bit more about clinical nutrition and the main elements? So, you know, what you're actually working with.
Yeah. So nutrition, I mean, I feel like this is stating the obvious, but nutrition it's a key component of our health, really. And so when we start to get the fundamentals right with our diet and also with our lifestyle and with our relationship to food, it can have a massive impact on our overall health. And so it's not just about preventative health. You know, I really work with women who have chronic health conditions. And so, look at diet. So a person's diet, this is what we eat most days, right? So I would sort of look at it in terms of the 80-20 rule. So what someone eats most of the time. So if you occasionally eat, you know, chips or whatever, like it really doesn't matter. It's what you eat majority of the time. Your habits are really what determines your health. And that can be really challenging. Changing habits can be really difficult. And that's why working with a trained health professional can make such a huge difference. So it's really looking at diet, so getting those habits in and tailoring your diet to your individual needs. So I feel like there's a lot of confusion out there. A lot of people come to me really confused about what do I eat, because they're seeing what's being posted on social media. Yeah. And they're like, oh, I'm going to try this. I'm going to try keto. I'm going to try this. I'm going to try that. And they end up really quite confused as to what they should be doing. So my goal is always to make my patients' lives a lot easier and to also make sure that we're building a really healthy and happy relationship with food, because it shouldn't take over your life. Because that's really going to detract from your health if it just becomes something you have to really worry about. So so I think that's kind of, I'm hoping I answered your question.
Yeah, definitely. And I think it's really interesting that you bring up how people have access to so much information and it's so conflicting. And as you say, like, you know, there's these labels that are put on these different diets and these rules around these specific diets that can feel so restrictive, like, oh, I have to be keto or I have to be whatever. So I hear what you're saying is that, you know, you just get the fundamentals right, that what's going to work for that person is going to help them enjoy it and relate to it better, because they're not adhering to these rules that have been imposed by like someone. It's working, you know, and having that relationship with you is going to help as well. You know, you're this person who's got, you know, how many years of university studies and has done the test with that person and builds that understanding of that person and can then let them know what works for them as well.
Yeah. So I think it's, so the way that I'll work with my patients is very much like I'll incorporate, like you said at the beginning, so that, you know, working with evidence-based nutrition, so understanding that, but also working with the person, understanding what what suits them, what suits their lifestyle, and what's going on individually for that person. So it's very much individualized treatment, and also incorporate a lot of things like mindfulness, mindful eating, and almost intuitive eating as well. So learning to know what works best for you. But also incorporating things like testing. So I will always be looking at pathology, or potentially even, ordering testing for my patients, just so that we know, it's good to have things to measure as well. So before and after. So that's another key component.
So what might be some of those tests, and what kind of information are you gleaning from those?
So just looking at, it might be general blood work, which a GP could order. So things like, for instance, vitamin D. So we know that vitamin D is such an important, it's all important, right? But like vitamin D, we have really chronically low levels of vitamin D in our society. And I think that's mainly possibly linked to the overuse of sunscreen, and not saying that we should never use sunscreen, but we do need some sun exposure. And we know vitamin D is so important for so many things. And one of those things is immune health. We know that it prevents the risk, it reduces the risk of cancer. It's important for bone density, the absorption of calcium, so many things. So and, just having low levels of vitamin D can contribute to fatigue. So fatigue is a really common symptom that I will see, especially in patients who are dealing with chronic health conditions. And fatigue can be, that can be a result of so many things. So we need to rule out things like B12 deficiency, vitamin D deficiency, so many things like iron deficiency, those types of things. So it's really trying to get to the root cause, and sometimes just those simple blood tests that are Medicare covered that your GP can order, that's often the first port of call. So we can then, dig in and just see, are we all okay in this area?
Yeah.
And it gives us, it just really gives us something to measure and make sure that we're addressing every possible facet or aspect. So
when you start moving into the digestive health, what might be some of the things that you're looking at in that space?
So digestive health, that's definitely an area that I work a lot in. I've got to definitely have a special interest there, and so there are lots of different tests that we can look at for a person's gut health. It really depends on their symptoms. So if someone has, this is just an example, so they have classic IBS symptoms. So they've got bloating, and they've got, 1 minute they're constipated and they've got diarrhea, and everyone's really different. So it's really, I don't think you can generalize, but one avenue, because a really common cause of IBS is SIBO, which is small intestinal bacterial overgrowth. So we can actually test for SIBO. So that might be a test, a breath test, and we can then, I will then order that test for that, for the patient, and then we can see, that gives us something to go on. We can potentially diagnose them with SIBO if that comes back positive. Another test might be a microbiome test, and there's all different variations of microbiome tests, but these are they're super interesting. And because they really give you an insight as to what's going on in your gut. And there's just so much growing evidence now about our gut microbiome and how much influence it has over our health. Like, it's absolutely fascinating, like everything from our mental health to, it's just really, and that can be another cause of fatigue. So just looping back to that, and it can contribute to inflammation as well. And we know, if I'm just talking about endometriosis, because I see a lot of patients with endometriosis, we know there's a link between the gut microbiome and endometriosis, in that there's an imbalance of good and bad bacteria in the gut. So so they're the sorts of tests that we might be looking at.
It's so true that you make that link from the gut health to the the reproductive health as well. Like, that whole, everything's connected, isn't it? Like, you know, there's, as you said, the influence of the gut on mental health. That's that head gut brain link. I'm doing a gut directed hypnosis course at the moment.
Fantastic.
That, is giving those suggestions to the gut of how you want it to behave. But the gut's also so fundamental for our immune system, like the immune system, the reproductive system. So it'd be interesting to hear a little bit more about those women health side of things that you work with as well, you know, and what's your role in women's health?
So when it comes to, if we're thinking about reproductive health, for instance, and just even thinking about endometriosis, just looping back to that.
Yeah.
So nutrition plays a key role in, it can really help to reduce inflammation in the body. But also when we're thinking about, so making sure we're having an anti-inflammatory diet, and that type of diet, I mean, at its core, really, like, it does depend on the person, like what's going on for that person, but it's essentially eating a whole foods diet. But it's also about addressing gut health issues as well. Which will help to reduce that inflammation.
Yeah.
And, you know, thus reducing symptoms, for instance, of endometriosis.
Yeah.
And especially if we think about fertility. So if fertility is a goal as well, it becomes exceptional. It just becomes so important. Just having that nutrient availability and making sure that your health is as good as it possibly can be to help you carry a child, because carrying a child, like, that's a big deal. Like, that's a lot of, you know, a lot on your body. And one thing that I also treat, one condition I also treat and see quite a lot of in clinic, is postnatal depletion. And so postnatal depletion is different from postnatal depression. The postnatal depletion is basically, it's essentially when you are depleted mentally, emotionally, nutritionally. Women are exhausted after having kids.
Yeah.
And this is due to a range of factors. I won't go too much into this, but but nutrition plays a really key role. So making sure that you are nutritionally in the best health that you can be for carrying a child is so important. So I think that's really, nutrition plays a really, really important role in both preventive health, so preparing your body for, say, fertility, but also addressing symptoms. So whether that be gut issues, and you know, we can also use, so I'll also use supplements in addition to diet if I feel like that's necessary as well. So it really depends on the patient, but it can really just help, I suppose, accelerate that healing process.
Yeah. Because our food is so depleted, like the soil in Australia in particular is so depleted that there are some really key vitamins and minerals particularly minerals that are lacking in Australia, unfortunately. So yeah, that supplementation can be really critical. I know this can be so varied depending on the individual, but I mean, I know from going through my own fertility journey that there's so many days in which you want to have a lead up before the cycle that you're working with. Like, I think it's 90 days for egg, 120 days for sperm. Are there any other factors that women should be taking into consideration time-wise before they're leading into trying to conceive? Like, there's egg quality is one component. Are there any other key things that women should be considering with that sort of lead time? Because I'd be interested in that, you know, how long it can take some women to recover from that depletion as well. Just those before and after kind of timeframes.
Yeah, so in terms of timeframes, I mean, we're thinking about, probably about 3 months before we're wanting to actually get pregnant. So starting to think nutritionally about supporting our body. And then look, postnatal depletion and supporting your health, like that doesn't stop after you have birth, give birth. That's honestly, I've seen women with postnatal depletion years after they've given birth. So it's something that can really be quite ongoing, especially if someone has one child and then 1 or 2 years later they have another child, because it's kind of just compounded. And that's a whole range of things. So women are not just mothers, they're working, so they're juggling so many things. And possibly quite sleep deprived as well, and trying to just juggle everything. And it also makes it quite tricky too to make sure that your diet is appropriate, or you're getting the right nutrients in when you're trying to juggle so much. So so in terms of the timeline, it really just varies to quite a lot with postnatal depletion, but it can be years after.
Yeah. That does surprise me. And, just thinking about my own kids and how fussy kids can be, can even like determine what you're eating at nighttime, so you're not making multiple meals. So
Definitely. So I always try to, when I see have my patients in who've got kids, like I always try and think about that as well. It's like, how can I make my client's life easier rather than so that does make it more challenging, but it's it can be done.
It is manageable for sure. So I wanted to ask, what about your own personal story has led you into this space? So you alluded before, you bring mindfulness in. I know as well that you're a yoga teacher. So, what led you into this really holistic view of health?
So look, I had my own journey, my own personal history with struggling with endometriosis. I also have adenomyosis. So it really impacted my health. I had 3 surgeries all up. And I guess what I learned from that journey was, I guess I discovered the power of food and lifestyle, and how that really impacted my health in a positive way, and also my mindset as well. So I guess it just helped me to recover from everything I'd been through. And I really am a firm believer in that holistic lifestyle. And so I had that personal experience of it really helping me and bring me back. I was very, very unwell, like very, very sick for quite a few years. Diet and lifestyle. So a really gentle form of yoga. I wasn't able to practice, do a strong practice when I was unwell. But just that diet and lifestyle made such a huge, huge difference to my overall health, and it inspired me so much. I'd always been a foodie, so it really inspired me so much that I went back to uni. So I went back to uni and studied nutrition, and also really embedded myself in yoga. And then after practicing, I've been practicing for about 10 years. Then I eventually did my yoga teacher training, so I really love the power of yoga and meditation, and I'm sure this is something that that you agree with, just the power of these sorts of practices, the mind-body practices, and just how much they can benefit your overall health, and especially when it becomes a habit, like something that you ingrain on a daily basis. It can be so powerful. It really can. So that's kind of my story.
And what have been some of the success stories that you've seen in some of your clients?
So look, I mean, there's been a few success stories. Let me just try and reflect on some of them recently. But look, I think one client who comes to mind, actually, she had quite severe endometriosis. And yeah, she had, and food intolerances, and it was all going on for her. So she had a number of health issues, which were quite complex. And I worked with her over a period of time. And she was all on board with the journey, and it was so beautiful to see her health improve, like her gut health slowly improve as well. So, and yeah, now she's actually pregnant. So she fell pregnant, which is amazing to see. So yeah, so that was, it's always lovely when that happens. But that was that was a goal of hers, was to be pregnant. So yeah, so that was really lovely to see, and also I think seeing people be able to enjoy food again. So I've had a number of patients that I've worked with who just struggled so much, like to the point where they just don't even know what to eat anymore, or they're like literally eating 2 or 3 foods. And yeah, there's a number of clients that I've had who've been through this journey, and they're so stressed and literally don't know what to eat. So working with them and being able for them to be able to now enjoy food, and again, it's been amazing to see, and to see like massive symptom improvement as well. Amazing. So so that's always really rewarding. And to see, especially like as well with my endometriosis patients, or people dealing with chronic pain, to really see their symptom improvement and quality of life. So that was amazing, and just makes me feel so happy that that we can do that, and it's just through the power of food and like healthy habits. It's always amazing to see.
Very rewarding. For everyone.
Yes, definitely. Because I think the beauty of nutrition is that, or with lifestyle as well, is it puts you in the driver's seat. So it gives you back some control over your life. And often if you are dealing with something you feel like you can't control, so a condition like endometriosis, you're going from doctor to doctor, or you're having to deal with surgery, this gives you something that you can control. So yes, like I might be guiding you, but ultimately you're in the driver's seat. So it's quite empowering.
Yeah, for sure. Like the tools, you provide those tools, and then as you say, like they've got choice. They've still got choice then. And actually it increases their choice, as you say. Like if they've narrowed it down to, I think I can only eat these 2 things, with the information you provide, both through, their own specific individual data, and then your knowledge, is such a powerful combination to empower them with that knowledge and give them those choices.
Awesome. Yeah, for sure.
So good. Now, before we wrap up, is there anything that you want to share that you feel hasn't been covered by our chat today?
Look, I don't think so. I mean, you can find, if you're interested in resources and things, you can find some things on my website, which is just my name. So Meredith East-Powell. So I've written some articles on there, just relating to, women's health sort of stuff, endometriosis and digestive health topics as well. So you can find an hormone related article, so you can have a read there. There's also recipes too. And links to my socials if you're interested in that. So took a little while off the social media front for a few months, but slowly getting back on board. But so I think my website's got some nice resources if you want to have a little bit of a read.
Great. And how can people work with you?
So you can book with me through my website, or you can find me at Pair Exercise Physiology. So I'm at Pair every Friday.
Cool. So that's if you're in Brisbane. So what if people are across Australia?
So I see me online. So you can book with me online or in person if you prefer it at Pair.
And are you only working one-on-one? Because I thought I saw a little program that you had the other day.
Yeah. So that is a one-on-one program. So that program, and you can see that through the website as well. So that's an 8-week program. And you can book that through the website. And that's really, I designed that program to incorporate, again, it's taking on that real holistic approach. So it's for anyone who's maybe, who really wants to dive in and take control of their health issues and get that holistic support. So basically you get me one-on-one supporting you for 8 weeks, and it involves, you'll get follow-up regular nutrition consults. I'll also create a meal plan for you, so food plan, and it also involves yoga and meditation, stress management. So yeah, it's a program it's really holistic and designed to support you one-on-one. So it's completely tailored and individualized. Yeah.
Nice. Bringing all your elements together.
Yeah, exactly.
Fantastic. Oh, well, thank you so much for coming on and chatting with us today, Meredith. And if anyone is keen to get in touch with Meredith, as you said, her website is Meredith East-Powell. Is it .com.au?
I think it's either or. So it's just .com, but if you put in AU, you'll still find it. Yeah.
Brilliant. Perfect. Awesome.
Yeah. And if there's questions as well, like I'm happy to answer them. Yeah, so feel free. Just let me know. I'm happy to try and answer.
Yeah, cool. Because you can put comments below this interview, and Meredith is in the group, so you can tag her and check in with her. And you've also got your own Facebook group as well, haven't you?
Yes, I do. Endometriosis Diet and Natural Health. So that group, so that's really tailored, as you would guess, for endometriosis. It's really focused on that. So if you are affected by that, there's been some interviews with different health practitioners in that group. You were one of those, Belinda. Yeah, so there's some nice resources in there as well.
Beautiful. Awesome. All right. Well, we'll leave it there, and we'll be doing more of these interviews in the coming months. I've got some amazing practitioners lined up once a month, and alternated with personal stories. So I'll be putting a call out if anyone has a personal women's health story that they think would be valuable to share with other members. Please get in touch. But I'll see you next time.
Thanks, Belinda. Bye, everyone.